Today, we're talking about the microneedling system backed by two of the most famous dermatologists on the internet, Drs. Shah and Maxfield, the handsome team behind Doctorly. I'm Dr. Sarah Shu, and I'm a Stanford-trained dermatologist practicing in the Seattle area. I have no sponsorship or relationship to Qure or any microneedling company, and I share my honest thoughts even when it's a stupid thing to do. I get a lot of questions in my comments about home beauty devices, and microneedling is one of the most popular and affordable at-home options. Compared to other home beauty devices, microneedling has a smaller startup cost, and it's super easy to do. You just push in a stamp or roll a derma roller. But it's not for everyone, and I've seen home microneedling go very wrong. I made this video to cover all the things I'd want to know if I weren't a dermatologist and to give you a balanced look at the good and bad of a home microneedling system like this one. Cure's microneedling system is called a micro-infusion system, meaning that it's a microneedling tool that's designed to improve the penetration of topicals. The needling creates microscopic holes in your skin that gives serums a shortcut to get into your skin. Cure promises that its microinfusion system can help reduce the appearance of fine lines and wrinkles, and that it promotes hydration for dewy and plump-looking skin. Notice the language, and you'll notice this everywhere with skincare advertising. It helps reduce the appearance of fine lines and wrinkles. It's not saying that it actually reduces fine lines and wrinkles, just that it reduces the appearance of them. It promotes hydration for dewy and plump looking skin, not necessarily that it makes your skin more dewy or plump. That before and after photo is pretty impressive though. The website also promises that this treatment is an at-home option for those who want to avoid the hassle or cost of going to the office. So the marketing draws a parallel between the Cure system and in-office microneedling, also known as collagen induction therapy, which can cost hundreds of dollars per treatment in office. Pricing is always changing on these Cure systems because there's pretty much always a promotion, but you can get a 1 month supply of the Qure Microinfusion System for about $119 or about $60 per treatment. If you buy in bulk, the cost goes down a lot. When I checked in July for $60 more, you could get a whole 6 month supply for $179, which brings the cost per treatment down to just $15. I want to be extremely clear here. Home microneedling and in-office microneedling are not the same thing. When you buy a home microneedling system, the FDA considers these to be cosmetic tools. You're going to find needles 0.25, 0.3, maybe zero point 0.5 millimeters long, like this one. You can find devices with longer needles online, but that's grounds for the FDA sending that company a cease and desist. At longer needle lengths, these are classified as medical devices, not cosmetic tools. Depending on what you're trying to treat, including wrinkles, acne scarring, and stretch marks, needle lengths might go up to 4 times or even 6 times longer than the home microneedling treatments. To see big improvements in the things that I mentioned, wrinkles, acne scarring, and stretch marks, you have to reach the dermis, which is the deeper layer of your skin. You're creating controlled wounds in the deeper layer of skin and forcing it to heal itself. And while it heals itself, it makes new collagen. Longer needles aren't always better, though. That's where you run into the risk of complications like scarring, increased risk of infection, and foreign body granulomas. That's why the FDA classifies these longer needle devices as medical devices instead of cosmetic devices. You can do real harm using these things if you don't know what you're doing. With a 0.5 millimeter needle length like you're finding in the Cure kits, you're mostly poking holes in the epidermis or outer layer of skin and not getting deep enough to stimulate that deep wound healing process that makes new collagen. Except the eyelids. Eyelid skin is super thin, and even itty bitty 0.5 millimeter needles could technically get into the deeper layer of skin there. So, this is an area that everyone needs to be extra careful around. That said, home microneedling isn't useless. By poking holes in the outer layer of your skin, you're creating little passages in the skin to help your topicals penetrate. One of the main functions of our skin is to keep things out, which is why skincare by itself rarely leads to wow results. But with microneedling, even at shorter needle lengths, you're giving topicals and active ingredients that temporary shortcut to get into your skin. Quick note about rollers versus stampers. I hear a lot of people talking about how stampers are better than rollers. Stamping treatments like cures are more predictable since the needles are stabbing straight into your skin. versus rollers. When you roll the needles across your skin, the needles enter at a bit of an angle. Remember the Pythagorean theorem? With a roller, the needle is the hypotenuse. So for the same length of needle, your depth of penetration is shallower than the length of the needle. The actual depth is less predictable. I see a lot of people talking about how roller devices aren't safe. Supposedly, they have a greater risk for injury, discoloration, and scarring. And I understand that from a theoretical perspective, but I haven't seen any clinical evidence for this with the itty bitty needle lengths that are used for at home microneedling. If you're not reaching the dermis with a zero point 0.5 millimeter stamp device, then you're definitely not reaching the dermis with a zero point 0.5 millimeter roller since the depth of penetration is even more shallow. Now let's talk about how to use it. You open up the serum and they're packaged individually. You have to take off this little metal ring and then pull off the top. Then you pour the serum into the treatment vial. Then you screw the cap with the little needles on. Qure recommends that you let it sit upside down for at least 1 minute. This primes the setup so that the serum comes out more easily when you start using it. To me, the number one most critical step is thoroughly cleaning your face. You cannot completely eliminate the risk for infection, but you can absolutely lower your risk. I used an antimicrobial wash from an American brand called CLN, which contains sodium hypochlorite to help disinfect my skin before starting. Then I used a clean towel to dry off. Qure also recommends spraying hypochlorous acid for extra antimicrobial effect. Tower 28 is one of the most well-known brands for hypochlorous acid sprays. Dr. Sam Ellis's brand Prequel also carries one. I used one from the brand Briotech because it was a good deal. Prequels is reasonably priced too. So while I was doing all that, the microneedling serum kit has been getting primed, my face is clean, and now we're ready to start. This is a very creepy grid showing the recommended routine. I've used an in-office microneedling pen before, and I think that the motorized pens are more comfortable since the vibration distracts from the feeling of getting stabbed repeatedly. I'm surprised that people can calmly talk while stabbing their face with this. Respect. I've seen some people mention that it feels like tapping your nails on your face, but it felt more uncomfortable than that to me. With just a gentle tap, I don't think the needles actually get in all the way. Even after prepping the device by putting it upside down for a minute or two, I didn't feel like the serum was flowing very well. I think it's because the angle that you're holding it when you stand or sit, the solution is not really in contact with the needle head when you're holding the vial horizontally. For me personally, it was more comfortable and there was better and more consistent flow of serum when I laid down during treatment. That way, gravity was my friend. At the end of my treatment, there was still a ton of leftover serum, so I directly applied it to my face, neck, and hands. On areas where I treated with microneedling, the serum made my skin sting and burn for a few seconds. In a second, I'll share what I liked and disliked about the Qure Microinfusion system. If you like content like this, consider sending a like or subscribe my way. It helps my channel grow. Some things I like about this system. I like the fact that the needles are plated with 24 karat gold, not because it's fancy, but because it's rare to develop a contact allergy to 24 karat gold. I have seen other companies advertise that they use surgical steel needles, but even medical grade surgical steel contains nickel. Nickel is one of the most common skin allergens in existence, and it is the most problematic metal when it comes to causing skin allergies. Overall, though, the risk of developing a new contact allergy from the needle is low whether you're using 24 karat gold plated needles or surgical steel needles because the total time the metal is in contact with your skin is really short. Next, I appreciate that they pair their microneedling system with specific serums, not because it's a clever way to make more money, but because serums used with microneedling in office or at home should contain minimal ingredients, less than a typical leave-on serum. We are using needles to pierce the skin and impair its barrier on purpose. We need to avoid any ingredient that doesn't serve an essential purpose because of the increased potential for irritation and allergic sensitization. For example, compare the ingredients list for the Qure Hyperpigmentation Serum and a leave-on serum I use a lot, Iope's PDRN Caffeine Shot. The Iope product is meant for topical leave-on use, not to be microneedled into the skin. You want microneedling serums to have minimal ingredients because having ingredients penetrate more deeply isn't always sunshine and rainbows. It's a double-edged sword. Deeper penetration means greater potential for irritation and allergenicity. Okay, now I'm about to get picky. One of my patients said I was like a tiger mom or tiger dermatologist because I'm always aiming for more improvement as long as it's safe. I'm like the tiger mom with skincare too. I totally get I'm hard to please, but it is my job to be safety minded, not to be a hype troll. Some things I don't like about this system. At first, I thought every component was single use and individually packaged. You have a fresh set of individually packaged single use needle heads and individually packaged single use serums. But for this package of 6 serums, I'm supposed to reuse the treatment chamber, the part that I pour the serum into, 6 times. Treatments are recommended every 2 weeks, so that means you're keeping this treatment chamber for at least 3 months. Cure's instruction guide tells me that I should wash the chamber out with water and a gentle cleanser and let the device air dry completely on a clean surface before packing away, and I should replace the needle head as well before packing it away. I rinsed mine out with water and a cleanser, then rinsed it out with 70% ethanol, let that evaporate, then put a new needle tip on. But you can see why, even if you use a new serum and a new needle head, if the canister is contaminated, it doesn't matter if the serum and needle are new. They're all in contact with each other. So take care to clean the treatment chamber really well after use. So the serum isn't perfect when it comes to an infection control perspective, but that is still a lot better than what I've heard some people doing at home, which is just reusing the same derma roller over and over again and keeping it stored in a cup of rubbing alcohol. Next, I don't think their serums are as minimal as they could be. Like rosewater. Rosewater has small amounts of contact allergens like geraniol and eugenol. I could also live without the Myrothamnus flabellifolia or resurrection plant extract, even though resurrection plant is a pretty badass name for a plant, and the chrysanthemum indicum or golden chamomile extract. Botanicals like these are added for their anti-inflammatory effects, but they don't have strong evidence for benefit in living humans. So including them adds risk from my perspective without adding proven clinical benefit. They are great for marketing purposes though. Finally, I feel like I'm the only one, but I have to say it. I really just don't like how it feels. I don't like the feeling of forcing the needles into my skin and doing it over and over again with the goal of reaching 2 to 3 passes. I find it tedious and uncomfortable. I wish I could be cool and totally unbothered by it because plenty of people say that this feels like nothing to them. But like usual, I am not cool. So after my first 2 treatments, white knuckling it, starting with the third treatment, I started pre-treating with topical lidocaine for 15 minutes to make it more comfortable for myself. If you decide to do this, make sure to wash the lidocaine off completely though before you start your treatment. I sound pretty cautious, especially when it comes to infection risk, but to add some context, I have seen home microneedling go very, very wrong. Take a look at this picture. I remember hearing about this patient at Stanford Dermatology Grand Rounds when I was there as a resident. This patient had thought she had an acne breakout on her chest, microneedled over it, then used the same microneedling device on her face. That acne breakout on her face turns out that it was shingles, and she ended up spreading the varicella or chickenpox virus all over her face. Another patient that comes to mind, they spread a bacterial infection all over their face with their microneedling device, thinking that the infection was eczema. So, for the love of God, if you have a weird looking pimple, a rash, or a blister, do not microneedle over that thing. With longer needles that people are using at home, nothing I say is going to keep people from watching YouTube videos and stabbing themselves with 2 or 3 millimeter length needles at home. Ultimately, people are going to do it, and if so, we should try to educate and reduce the risk that people will have problems. In the description, I'll link the FDA's page on microneedling because I like their summary of people microneedling is not suitable for. Please take a look if you are microneedling curious. For as simple as this treatment sounds, it's hard for me to be on board with the widespread home use of longer needles because of the complications I've seen as a physician. Even when used in the office, these deeper needle lengths can harm people. For example, take a look at this case series. These women had vitamin C and hyaluronic acid products applied to their skin at the same med spa, not a dermatologist's office. Then they had a microneedling treatment. All of these women developed pretty disfiguring rashes, which required treatment at the University of Utah Dermatology Department, and some of them even developed symptoms like fever, joint pain, and elevated blood markers for inflammation after their treatments. So, in addition to not needling over unknown growths or rashes, I also worry about the products people are using with the devices. Like the paper says, only chemicals approved for intradermal injection are safe to be used with microneedling. Since the Qure system uses pretty shallow needles, I am less concerned that people will end up in the hospital with serious allergic or hypersensitivity reactions like these women did. If you are microneedling curious, Qure is a reasonable way to dip your toes into the water. I don't think it's a perfect system, and I shared my Tiger Mom opinions on what I wish were different. Apparently, I'm a wimp for this kind of discomfort, so it's not a treatment I see myself using regularly, but that doesn't mean that you won't tolerate it. That's it for my detailed thoughts on the Qure Microneedling system. Share your thoughts in the comments. I love to learn from my commenters, and thanks for watching.